you are now, well, we talked about this a little bit. You are post-clinical trial. You're not completely, you said end of 2 years, you'll probably know whether you're completely in the clear.
Yeah.
You have, how often do you have checkups? How often do you see the doctor?
I have checkup weekly now. I used to do 3 weeks, 3 days a week. Now I'm doing weekly.
Mhm.
Yes, like today I had this week I've done twice because there was a scare of after some blood work. So I had to redo it again today. Yeah.
Mm,
So it's
okay.
typically once a week.
Okay.
Yeah.
And you also,
Yeah.
you mentioned at one point you have some post-clinical trial chronic diseases, you have some heart issues, things like that that you're dealing with. Are you still dealing with some of that?
Yes, yes. Actually, the heart issue was after the chemo. It was side effects of the chemotherapy.
Okay,
So which now got a bit worse with the clinical trials, but now it's very stable because
good.
I'm no longer using the pipes. I'm breathing now on my own. So that is a plus after a
Good.
couple of years, almost 3 years or so. So the other side effects mostly is the headaches. Sometimes they are really, really, really bad compared to the earlier before the clinical trials. Yeah, I think those are the major ones. The ones that were there, the nausea, it's like they keep lessening. They are less now. I'm able to manage apart from now the pain because now for the pain, at some point I have to go for a morphine injection at the
Mm,
hospital when it gets that bad. Yeah.
right, right. And do they know, like the headaches, and do they know what's causing that, or is it just sort of a thing you need to manage?
Okay, at first they had noted something, but they weren't sure whether it was because of the earlier treatment of the cancer or it is the clinical trial.
Okay.
So I've been also on a medication of the same, but it has cleared because sometimes the other side effect is sometimes the nerves. There are times they can't move, mostly even my legs from the waist down. I can't move. They just
Mm,
yeah, but just for a while and then they get back.
then it's okay. Yeah.
I know it's okay. It gets better.
It's better.
Yeah.
Yeah. Well, you've been, I mean, you seem great. So I'm happy that you're doing better and that there's hope and you're moving
Yeah.
forward. Do you mind
Yeah.
talking a little bit about the emotional impact that you've gone through with all of this? And then I know we talked about a little bit about isolation and uh, family support, um, things like that. I know we touched on it earlier a little bit, but maybe we can talk specifically about some of those issues when you were diagnosed, and then how was the support when you ended up going through the clinical trial?
From diagnosis, let me say everyone was there. Family was supportive but after a few years, some of them, I think, either got tired or the road just seemed so hard. So some withdrew along the way. And I understand. And then let me say there are people who still stuck and have still stuck with me till now. Though along the way, I've also lost a lot of friends and a lot of family. But I think it's because of the fear. Because when you stay with someone that you're not certain about tomorrow, so sometimes people tend to distance themselves. So
Yeah.
emotionally, at that time from diagnosis, it was hard because I bottled up all the pain, all the emotions I couldn't show. It was one of the most terrifying moments. And by bottling those emotions, ended up getting depression and later I went mad or rather I went crazy because of those all those emotions. But right now I can say I'm in a better place. I'm able to balance my light and my dark. So when I'm low, at least I know how to balance it now. I'm not able to speak about everything to everyone. I choose one person or the other. But
Yeah.
it's amazing because I find myself in a support group, the people that we've gone through, I'm able to share everything. So there's nothing left for me to like bottling up,
Yeah.
because they might be young people, they might be teens, young, but we are going almost through the same thing. So as they share, I also now let out also my emotional distress. And the other challenge I can say now, what after survivorship, I think it also gets harder because life now it's not the same. Even when people want you to be back to where to continue from where you left, it is hard. I've realized
Yeah.
it is really, really hard. So you become a new person and sometimes even look for new friends because you no longer fit in where you were before the diagnosis. You feel young.
Yeah.
So emotions also change. Emotions also change. And there's, I can say there's that solitude, there's that lonely. You find yourself sometimes even better when you're by yourself, other than being in a group where you see people like us still asking questions. Yeah.
Yeah.
So
Sometimes you feel more alone in a group than you do by yourself.
yes, yes,
Yeah.
yes.
Yeah. And again, that speaks to the communication and the need for supporting others because it also helps you, right?
Yeah,
Yeah.
yeah. A lot, a lot.